So my people, once again I want to bring you the gyna, and you remember the other time we did the interview with our gyna, and again he has given us another opportunity to come and have an interactive time with him. So let's go. I'm in Thika town, it's our house, and as you can see from the Kimbao, Dr. Wanyoro is the one who will be gracing our studios this day. And of course, you know I'm excited because these are things that I like. And this is a good place. A quiet, as you can see, the environment is very good. And like I said last time, this is not a paid, paid promo. I've not been paid to advertise anybody. I'm not even sure that doctors advertise themselves. I don't know. So I'm not doing this because I've been advertised. I'm only doing this because of my viewers, Suzie Yule Diadem subscribers. I want you to know if you have a gynecological issue and you want a very good gyna to visit, I want to just let you know where you can go. So this is not for payment, it is for you, my guys, because I love you so much. That's why I'm directing you and I'm telling you where to find Dr. Wanyoro. So yes, that is his label, Dr. Wanyoro, and here is his office with the very lovely ladies in here. When you come here, you will be met by some very beautiful ladies, as you can see. And this smile is not because they are on camera. Me, every time I come, hi ladies.
Hi.
Why are you guys always smiling?
Keep in touch with our patients.
Yeah. Wow.
Our patients, that is our passion. Yeah, to take care of them.
Okay.
Yeah, everything starts here. Reception. They meet our good doctor there.
Okay.
Yeah.
Wow. Hi guys, Suzie Yule Diadem, living positive regardless. Doesn't matter the point at which you are in life, but we love positivity all the way. I bless God for giving us this chance that we may also have another time for inspiration, to learn and also to grow together. Thank you so much. I will not hesitate to just thank you, my guys, because now we are on our way to 6,000 subscribers, and I really do appreciate. Thank you for those who are watching, for those who are sharing these videos. You never know who you're going to help as you share these videos. Today, I'll not take too much in this introduction because I have a guest that I know most of you have waited to meet, and we thank God that we have been given another privilege to meet my gyna. Yes, I am at Thika at a building called Our House. That is where I'm going to meet my gyna in one of his offices, and so we shall have a very informative time and a very informative discussion. But before I go too far, I'll just allow our gyna. How are you, Dr.
I'm good. Yeah,
thank you so much for another moment and sparing your time for us.
You are welcome.
Yes.
Yeah.
So I'll let you, maybe for that person who have not watched our previous video, so I'll let you just introduce yourself, who you are, what you do. Yes, we get to know you.
Well, my name is Dr. Anthony Wanyoro. I'm an obstetrician gynecologist of many years, and I have special interest in taking care of problems that involves women, especially problems of infertility, problems related to pregnancy and delivery, and of course any gyna problems. I'm also a teacher. I teach at Kenyatta University. I'm currently an associate professor, so I also mentor students to become good doctors.
Wow. Guys, from that introduction, you definitely know why I am here. And now you know why I'm even smiling widely, because you know this is a topic that's so dear to me. And now you've heard about infertility mentioned. You know what I do about that. You've also had our doctor talking of the way he's committed to women. So we are in the right place at the right time with the right person. So karibuni sana. So Daktari, The last time we were here, we discussed a lot about infertility, causes of infertility, the available treatments and all that. And I must admit that time is really not doing justice on our side, but then we shall do what we are able to. And so today I want us to look at this term, IVF. Infertility, I've shared my story and many women have also shared their story, and infertility is such a big issue in our society, and it is really working out our emotions, our finances, and even our physical growth. And now we come to IVF. Last time you mentioned and you said we have been saying IVF is very expensive for us, but you said to you don't want to say it is expensive, but you want to say it is costly. So let's start by defining what IVF is before you tell us why you think you will not say it is expensive.
Thank you. So I think maybe to put it in perspective, I think we'll start with infertility. And it's unfortunate that some couples are not able to get a child or a pregnancy when they want to have a pregnancy for various reasons. And when a couple has been living together, having regular sexual intercourse, and they are not using any contraception, and they have tried to conceive for a whole year, then we call this infertility. And it has many causes. Of course, different causes will need different management. And one of the management is what Susan has said. It is using advanced reproductive technology, and a small part of that advanced reproductive technology is called IVF. And in full, IVF means in vitro fertilization, but there is something else that is usually added at the end, where after the in vitro fertilization means that fertilization of the female egg happens outside the body, unlike the natural fertilization, where the female egg is fertilized within the fallopian tubes. So IVF, all it means is that we want to take the eggs from the female's ovary and get the sperms from the man, and then we fertilize these eggs in the laboratory. Then what results after that fertilization is called an embryo. So you want, after doing in vitro fertilization, to transfer that embryo into the woman's womb, so that now it can now result into a pregnancy. That is what is called IVF and embryo transfer. Okay.
Wow, you've mentioned that there are many treatments for different causes of infertility. So maybe I would want to ask, for which problems do you think, who is this who needs the treatment for IVF?
Well, the treatment for IVF, of course, there are several indications. And one of the major indications is when the fallopian tubes are blocked. So it could be mainly a problem where the natural conception cannot happen. The egg when it is deposited into the woman, that egg cannot reach when the sperm is deposited, it cannot reach the ovum. So if there is any condition, like there is blocked fallopian tubes, or the men's egg are not adequate, or you cannot get from that egg from the testicle itself, then that can be an indication for in vitro fertilization. Of course, we also know there are also conditions, they are rare, but they are also common, where you find, like in the developed world, like maybe a man has passed on, and his sperms can also be harvested. Maybe he had a spouse and they have not had a child for whatever reason. Then this man passes on, or he develops like cancer of the testicles, and then he needs treatment. So you can preserve his sperms, and then those sperms can be used to do IVF in the future, and he can still get a child.
Okay.
Yeah, so there are many indications, but mainly in our country, the main number one indication is actually blocked fallopian tubes.
Okay. If a couple have any other problem and maybe they feel they don't want to go through the treatment that may be taking long, can they opt for IVF?
If they have the resources, we know there are also other social indications which are not very strong. Of course, you find also in the current dispensation, some situations are happening where you find maybe a couple is too far apart and they don't have time to make a child. Okay, maybe I'm working very far in another country, and of course my wife is in a different country, and we don't have time to make children. So people have also opted for IVF because of situation or social situations where we need to have a baby fast enough, and maybe the processes, the natural processes or other processes are not happening so fast.
Okay.
And we can also opt for an IVF.
I know you've told us that it involves about the embryo being planted to a woman's uterus. Are you able to help us understand the procedure, how it is done? Maybe is it surgical? How is the procedure of doing the IVF?
Thank you. In IVF, there is no surgical surgery involved.
Okay.
Naturally, what happens in a woman's cycle, we have two phases. The first phase is when the egg starts to develop after the periods have happened. And this is called the follicular phase. Then in the mid-cycle, there is ovulation. Okay, and when ovulation happens, then we enter into the next cycle just before ovulation, called the luteal phase. So what IVF does is that we would want to give the woman some medication so that you can synchronize the development of the follicles or the small eggs, we can call them. Then as those eggs or follicles develop, then you continuously monitor the egg development until they reach the stage where they can now, the stage just before ovulation happens. Then you give that woman some medication, usually in form of an injection. Then you can now get those eggs. You can have, we call it harvesting, the egg directly from the ovaries using an ultrasound which shows you the eggs, and you use a small needle that you can go into the ovary and you aspirate those eggs.
Okay.
Then you look at the microscope and look at the quality of those eggs.
Okay.
Then you get the sperms from the man. The sperms from the man can be gotten through masturbation.
Okay.
Okay, and then the quality of that sperms is improved. Okay, then those sperms are now put together with the eggs, and the fertilization happens.
Okay.
Yes.
Now that directs me to a question, because that harvesting looks like it's so well monitored, because you're able to see the growth of the eggs, because you have even boosted them. The sperms after harvesting, you're even boosting them. Now, where does this failure of IVF come from when all things look like they have been so well monitored?
Okay, so I think I'll go back to the cost, because the cost comes because of the processes that happens.
Okay.
Remember, one of the things that you must do when you are doing IVF is to keep these eggs alive outside the body. And this is where you need an IV lab. So capturing those eggs in special media so that those eggs do not die off is a major process. Two, the other issue is the quality of the eggs from the woman. Because when you get poor quality eggs, Even if they are fertilized, then they may result in poor quality embryos.
Okay.
And then with these embryos that are of poor quality, then they cannot be able to implant when you have put them into the woman's womb. Of course, IVF, if all goes well and then there is implantation, then the outset, of course, after that you get a pregnancy. And all the hazards that may happen in early pregnancy may also happen with an IVF pregnancy, because it's not a special pregnancy.
Okay.
So you can have failure of that, development of that implanted embryo. Okay, you can have a miscarriage, you can have abnormalities, all those things, because it's just a normal pregnancy, but assisted reproductive technology is used. Okay, so that we avoid the issue of man and woman having sexual intercourse and then a natural conception resulting.
Okay. So IVF has no advantage that you are able to improve this, the eggs to be good quality, so that you increase the levels and the chances of conception.
Thank you. That's a good question, because one of the other needs for IVF, other than the IVF specialist, is the need for somebody we call an embryologist. From the embryo, we get specialists called embryologists, from the word embryo. These are the people now who are able to look at those embryos and look at their development and also discern and decide this is a good embryo, this is a bad embryo. Okay? So you can be able in a way to determine the quality of those embryos. But of course, at the end of the day, you have many hazards, because even if you have a very good embryo, then the receptivity or the ability of the inner lining of the uterus, called the endometrium, also will determine whether that embryo is going to implant in that endometrium. So if the endometrium is also not good, you may have very good embryos, but the endometrium does not receive that embryo. So those are the various hazards that makes women sometimes fail to have a pregnancy or a pregnancy failing after embryo transfer.
Okay. Do you have a general rate of the success rate? It depends with the woman.
Well, of course, the rate depends on many issues, but of course the woman, the embryo, age of the woman, age of the man, whether there are genetic abnormalities in that embryo, etc. Okay. But when you look at the world of even in the best facilities, the rate is about 40 to 45% in the best facilities. Most of it is between 20 and 30% success rate. But for that woman who succeeds, then it is 100% in that woman. Okay. Success.
Wow, okay. What is compared to natural way of conceiving when someone doesn't have an issue? What is the rate of naturally when someone has no issue of conceiving in a normal human being?
Well, of course, we know that women are born with very many eggs. And it is not every cycle that a woman will be able to conceive. Because some cycles you find the egg that was ovulated is not fertilizable. Of course, the other thing is, we also cannot be able to tell 100% that this woman has ovulated or is about to ovulate. Okay? So you find that the timing is also a problem. And that's why we define infertility as a couple which has tried to conceive for 12 months and they have failed. Yes.
Okay. Is there a group of people, couple, who can be advised against IVF, who are not viable for IVF procedure?
Well, there are relative contraindications for IVF where you say this person is not a very good candidate, and there are also absolute contraindications, just like many other issues. So, of course, one of the things that you don't want to propagate in IVF is where there are major genetical or errors or diseases in couples that can be passed, and there is no way of bypassing that disease. So there is a major genetical abnormalities which can be passed, and especially the dominant ones that are passed through dominant genes. Then you can say this couple has, because of the high risk of getting a baby who is not very normal, then you may tell that couple that they are not good candidates. The other candidates are candidates with mental disorders, especially if you have not controlled mental disorders. Of course, when they are well controlled, then they can have a baby through IVF if there is a need. But of course, when there is mental disorders, major psychiatric disorders which are not controlled, then that is a relative contraindication. If there are uterine abnormalities, major uterine abnormalities, that this mother may not be able to carry that pregnancy, then you may also probably have a relative contraindication, but then this couple may look for a surrogate mother to carry the pregnancy. So, so you have genetical, you have the quality of the uterus, you have psychiatric problems, etc. that may lead to some contraindication to IVF.
Oh, Dr. I find this one interesting. I'm curious to know why would what is mental has to do with, okay, for example, if my partner gets mentally sick and I want to have a child, why is it?
Well, you see, the mental issues here is mainly related to is that woman. Let's say a woman has schizophrenia, which is a mental disorder that in most of the times you find these people walking around. Okay, and then are you going to do an IVF on that woman and you have not controlled that mental disorder? It is very unwise, because even if she succeeds to get pregnant and you have not controlled that major psychiatric condition, then what will be the quality of that pregnancy, and then what will happen to that baby who is born out of that woman? Because the woman needs to get pregnant, carry that pregnancy, deliver, breastfeed this baby, take care of the baby. So you don't want to have a situation where you have a pregnancy that you cannot have. Yes. So of course there are also these other problems that you find in a woman that may also need to become worse. Like if a woman has major heart disorder, a heart disease, then having that pregnancy, even through a normal pregnancy or through IVF, it puts that woman at a higher risk. So that can also be a major contraindication to any type of pregnancy.
All right. IVF, does it have any side effects for the couple who is doing the procedure?
Well, what I believe is that the processes may have their own special issues. And also, of course, now there are also special conditions that are special because a woman is pregnant. So she may get into some complications just because she's pregnant. Okay, and we know that, of course, we have many conditions that get worse during pregnancy, but not because of IVF. But now let us look at IVF itself. So we talked about the issue of enhancing the production of the egg. That is a very critical point, because remember, you are doing drugs to have to make this woman to ovulate. They are called ovulation induction medicines.
Okay.
And one of the problems with ovulation induction is that you may have a condition where we say that you have hyperstimulation of the ovaries. So hyperstimulation in layman's language means that a woman is producing so many eggs at the same time. And that can be a dangerous condition. And that's why during the ovulation induction, in an IVF cycle, you have to monitor the number of eggs that are growing. Because if they grow too many, they start to develop too many, then you even stop that cycle. So that you reduce the risk of ovarian hyperstimulation. Of course, with the current advanced reproductive technology, then we have known how to use the medication so that you don't have the many women having abandoning a cycle because of ovulation hyperstimulation. That's one of the major dangers that women undergo when we are doing ovulation.
IVF. So for men, they are safe?
For men, they are safe because there is no process that, there's nothing that is done in the man. Of course, we know, of course, there are also issues with getting the semen. There are some men, either because of religious issues, where they are not allowed to use masturbation or to ejaculate outside the female's body. So that in itself may have some little psychological issue with that man, which is still a problem.
True. And there is no any other way out. You can only accept it or opt out.
You can only accept because we need the semen.
Yes.
We need the sperm from the man. Unless it's that man who has a problem, like maybe they produce, the testicles are able to produce the sperms. But because of a blockage in the system, the sperms cannot be ejaculated. So they have ejaculation of semen which contains no sperms. Then you can go direct to the testicles and you get some baby sperms. Okay, we call them spermatids. Okay, young sperms. Then you can use the nucleus of that baby sperm and inject it directly into the female's egg. So this is a more advanced form of IVF, okay, called ICSI, or intracytoplasmic sperm injection. In situations where you find that you can only get the sperm, one sperm from the testicle. But it is more advanced and more expensive.
How long does an IVF procedure take from now starting to prepare the woman for the growth of the follicles up to the time now we are going to say now she's pregnant?
Within 1 cycle month, it should be, the woman should be ready and should be pregnant, just like the natural. So, but in some situations you find that to synchronize those cycles, and so that maybe the lab is able to use also its resources wisely, okay, then you may have to induce some women severally, at the same time, and then you do the fertilization at the same time, and then you are able to do the embryo transfer almost at the same time, so that you are able to synchronize the cycle and use the laboratory resources appropriately instead of having one woman every cycle. So you may find that some women are advised first we suppress a month prior. Okay, it also gives a better chance of getting quality embryo. But in essence, 1 cycle month is adequate for a woman to get pregnant.
And for how long would you preserve them? Like in the case where you're saying maybe a spouse is dead and maybe you want to use them in future because you might not want to conceive immediately. How long would that take?
Oh, that preservation of embryo can take forever. You can preserve embryos, you can preserve nowadays any cell forever. because they are very good preservation methods.
Okay.
So there are some cell lines, like we call hair cells for cancer, that were preserved for ladies who died many years back. Yes, so you can preserve cells for very long because we have very good preservation methods and freeze them.
What happens if now the spouse decides they don't want to have the children? Can they donate them to the hospital, or what happens?
Well, that is usually a dilemma. Like when you have, because like let's say you have 15 embryos in that cycle, so they will maybe use current thinking in centers that are very good in IVF. You only transfer one embryo because of one of the risks that may happen if you transfer more than one. And this is the risk of multiple pregnancies. Many people think that when I get two twins or triplets or quadruplets, that is an advantage, but that is a disadvantage. But because the main thing is that the more the number of babies in the uterus, the higher the chance that these babies will not reach term. Okay, so you may have very preterm babies and you are very happy that you got triplets because 3 embryos were transferred in the womb.
Yes.
So you find that, of course, in our country, normally they transfer 2 to 3 embryos. So if you are lucky and in one cycle you harvested 15 eggs from the woman and all of them were of good quality and you get 15 embryos, then you use 1, 2 or 3 maximum, then the others you preserve them. You do something called cryopreservation. Then of course the dilemma comes about what happens to these embryos. One, when they are preserved, the couple is supposed to pay for that preservation because it's also a resource-intensive way of preserving. Then what happens when this couple decides that these embryos should not, or they have had enough children, and then they no longer need those embryos? Then it's usually it's a medical dilemma because remember these are already embryos; they are living cells. Okay, then who do you give? Do you destroy them? Do you have, so that is usually a medical dilemma. Yes, and it, of course with the act that in our country we don't have an act as of now. It is actually being developed. Okay, on the IVF processes, advanced reproductive technology. What happens when do you get a surrogacy mother, and what happens to that? That child? Who does that child belong? What are the rights of this surrogate? What are the rights of this person whose eggs were used, etc. So we have a dilemma, and I think this is what the country is trying to come up with, so that we have an act that defines exactly what happens at what level.
Okay. Especially for the surrogacy, I really pray that we are able to get a solution to that and we are able to get a way forward, because for me I think that's one of the very best way of when a woman is like, you've even tried the IVF, it is failing and the medical is not able, the practitioners are not able to explain why, then I think surrogacy is a very good option. But then, right now the fears, I'm not sure we want to try that. Many of us, we don't want to try that as it is now. Now,
people are still trying, and also the surrogacy is where now a woman is not able to carry her own child, and she like rents another woman's womb to be able to carry that child, and then when she delivers, the child is given to you. But there are also couples that cannot make the eggs. So there is a man here who cannot make, doesn't have the sperms, or he has a major problem that can be passed to the children that he is likely to sign. Or there is a woman here, she has a very good uterus, but she cannot make eggs. Then of course we still have that other process of donor eggs, where a woman can, we as a couple we can decide, can we get donor sperms if my woman is okay, or can we get donor eggs if my sperms are okay but my wife's eggs are not good, and then she has a good uterus. Or it's a woman who has had an operation and her womb has been removed, and but her ovaries are still intact, or has had cancer, and we did procedures where we preserved the ovaries, so she continues to produce the eggs, but she cannot carry the child. Then surrogacy mothers are also needed. So there are many issues that needs to be sorted out.
Are we able to donate like a couple of embryos once we do like the 3 and they have succeeded? Are we able to donate someone else to use them?
As a couple and with the good consent, you can donate those, but of course a good consent needs to be available, and also a very good act of parliament, a very good law needs to be there, so that at the end of the day, if you donate to me, to us as a couple, and then something happens to your children,
you don't come for your child
and say that this is my child, genetically this is my child, and you want to have the child back.
Yes. So of course you've already answered us that you can choose if you want to have twins if you're going through IVF, because the way you have explained it, I can come and say for me as I do this IVF, I prefer to have twins, despite the challenges and the risks that you're saying. But are you able to manipulate the gender?
Let me go back to the twins. Actually, getting multiple pregnancies, twins, triplets, is a side effect of IVF.
Okay.
Because the ideal situation is to have one baby, okay, because you improve the outcome of that pregnancy. So in normal situation, it is not the couple that chooses to have twins. It is only that in setups where IVF has not developed very well, they would put 1 or 2, I mean 2 or 3 embryos.
Yes.
And sometimes you find more than 1 embryo implanting. So that is basically a side effect. It's not a choosing of the woman.
Okay.
Now, coming to the issue of choosing, you said gender?
Gender, yes.
Whether you want to have a male, a girl, or a boy,
yes.
there is also another dilemma.
Okay.
A pre-embryo genetic diagnosis is possible. And remember, sex is determined by only one set of chromosomes in our body. So we have different sex. We have the genetical sex, which is determined by whether I'm carrying an X, 2 X chromosomes, or an X and Y chromosome. So if I'm carrying 2 X chromosomes, one from the female, one from the male, then that is a genetic female. Then if I'm carrying an XY chromosome, then I am a genetic man.
Yes.
Then the other sex is determined by the outcome of what happens after that. It is called phenotypic sex. When you look at all of us, when we are in utero, okay, before a few days, a week, the first 7 weeks, we are actually undifferentiated.
Oh.
So you can resort to either a male or a female.
Oh.
Okay? It all depends on whether that embryo is carrying a Y chromosome. Because in the Y chromosome, that is where we have something called sex-determining region. So if I have a Y chromosome, then I'm likely to develop into a male, depending on whether the other things are happening, and then the woman carrying me does not have some problems, which she can be carrying some problems that will suppress my ability or her ability to have a baby who will be phenotypically a male. So genetically is a male, but phenotypically may come out as a female.
Oh, really?
Depending on the hormones that are dominant in the body.
Ah.
So it is possible to determine, but the main thing is that pre-embryo genetic diagnosis are usually done for major diseases that can be passed from the parents to the babies. And this is agreeable and it is allowed.
Okay.
Okay? So that if there is, there has been an inherited genetic disorder, then you don't want to implant that embryo.
Ah.
But where it is possible to determine genetically whether that embryo is male or female, it is also a moral dilemma and it is also unwise to be able to do that, just to be able to implant a male or a female by choice.
Okay.
And remember, these women or these couples who needs IVF are usually very desperate couples.
Sure.
So any gender, I don't think it's a major issue for them.
Sure.
Yeah.
I was looking at a point where I want to think for people who may be having boys only or girls only, and they think we want to try IVF in the choice of trying to get another gender, if that would be a choice for them.
For me, I don't think that is a good education for IVF. If we are able to get children, I don't think it will be prudent to waste resources for somebody else, which could be used by somebody else who is desperate, even to have that one child without one eye. Because when you are at that level where you are so desperate to get a child, you don't mind any. But choosing sex, the gender of a baby, I don't think it is very wise to use IVF for that.
Wow. Hey, what a session, guys. I hope you are learning. For me, I'm really learning a lot. And I really appreciate your time, Doc, for letting us into this very sensitive topic that has really left many people wondering if they want to go for it. But now, I just want to ask this. I don't know whether it is ethically right to ask, because I just feel like I want to ask this question. For many people have said, actually on my channel, there has been that some women saying that IVF should work, like you should not fail for IVF, it's like 100, because I shared my experience and I said it didn't work. Someone came and said it has worked for me, and another one said it is not 100% work. So there is that, and we were wondering, could it be, I know you have told us other factors that could lead to failed IVF, but then I'm also asking, hospital facilities, could they be a reason? Am I able to tell, like, Hapa, are there pointers that I'm able to tell, like a Raymond, so that we say, the reason as to why IVF didn't work for me is because I was in this facility and I need to go to a certain facility?
Thank you. I think that's a very important point. And as I said, IVF, when people opt for IVF, these are couples that we empathize with. They have used resources for many years, maybe in the peripheral facilities. They have tried, and you know, the issue of our society in as far as babies are concerned. So these are couples that are usually very desperate. And for that one child. Unfortunately, you also find that we have had situations where we have mushrooming IVF or centers that may, of course, say that they are doing IVF and embryo transfer, and they are not having very good laboratories. From the beginning, we said this is a very intensive procedure, and it also needs a person who is very, very well trained in IVF, and also other people like embryologists, which are not very many, even in this country. You might find maybe we have 2 or 3 embryologists in this country if we are very lucky.
Okay. Wow.
So for an IV laboratory is also a laboratory that needs a lot of equipment to keep those cells alive and to increase the chances of that embryo developing. Actually, how that process is undertaken, whether those people who are undertaking that IVF cycle are qualified enough, and whether that facility itself is also equipped as an IVF lab to increase the success of that IVF procedure. And whether they are also able to select the right candidates for IVF, looking at all factors, including the age and the ability of that person. Because sometimes you may find people are doing IVF without considering the ability of that couple to be able to produce quality eggs that will produce quality embryo that can be able to be successfully implanted. So for me, for couples that have this problem that may need IVF, I think it will be good to be wise and also to see your gynecologist so that they can also advise. Majority of us gynecologists, we don't do IVF, but if you see a gynecologist, they are able to advise, depending on your problem, on which is the best laboratory, IVF center, that you can have better success.
Wow. Okay, so guys, you have to do your due diligence, and thank you, because that answers to you. We had that, I think we were like 4 women who we answering, it can work, it should not work, it should work 100% unless you're in the wrong place. You've had it from the doctor. We need to do due diligence, but still there are other factors that can also lead to that. So we are going to end this discussion with just 2 questions that I want to ask the doctor. And unfortunately, we have now to come to an end to this discussion. But before we end it, Dr. I want to ask, IVF babies, are they any special babies, or they are just the normal baby like biologically conceived babies? I think with that, we can end that discussion there once you let us know about that.
Okay, thank you. To go back slightly, why is IVF not 100%? We have said there are several factors, but look at it as any other process. There is no process in the world that is 100% successful. Whether you are piloting a plane, sometimes planes will crash and kill 400, 500 people. Whether it's a bus, it might have an accident. So all processes that are done by the hands of man, none of them is 100%. So we only say it's only our maker who is 100% successful in whatever he does. And that's why we say there are failures in the system. But the outcome for that person who gets pregnant, we say that's 100% success. And this is what keeps people moving. So what is the result? The result is your child. Genetically, every fault that we have genetically, every success, every good thing we have, it is passed from our seeds to our children. So an IVF child is no different from any other child. The only difference is that the conception, couples do not have sexual intercourse to get these children. But the result is basically the same, as long as the egg came from my wife and of course my spouse. Yes.
Wow, thank you so very much. So history attested babies to weke kando. The baby you're calling the tested baby is as the whole being, just like your own child that you conceived biologically. I think that was very informative, Dr. We will edit there, and I really appreciate your time once again, and I pray that this information helps you viewers there, and I also pray that Dr. the next time we have questions you want to ask you, will still be available for us. I ask that on camera so that our viewers can know whether we'll have a chance?
Anytime you have a question related to any gynecological disorder, or you are carrying a baby and you want to, you have a question, that's why I wake up every morning very early to go teach students to be ambassadors for women, and also to come every day to work so that I can be ambassador for women for any of their problems.
Okay. Are we able to know where this every day we are able to find you?
Every day, unless I'm not there, you can find me teaching at Kenyatta University School of Medicine, either in the university itself or in the various hospitals, especially Kiambu Hospital, where we also offer services to women. Or if I am not there and it's my free time, you can find me in my clinic, in my office, which is located in Thika Town, in a house called Summer House.
Okay.
Yes.
Wow. Thank you very much, Daktari.
You're welcome.
Have a nice time.
Always
Till next time.
ready for any question.
Thank you. Guys, bye for now. Till next time. See you then.